Hi everyone, good evening. This is Dr. Tani Ping, consultant obstetrician and gynecologist. Okay, today I'm going to talk about something that I usually love talking about, which is called fetal programming. So in not just talking about maternal mental health, I'm also going to talk about fetal programming, but the large part of fetal programming we know is partly due to mother's emotional health. So this live video today is in a series of live videos that I started last week, all dealing with mother's emotion, you know. So we know women are a bit emotional when they are pregnant. Women in general, a lot of people will think that women are very emotional. So this is the entire series of talks, and I have some more to come, all on women's emotional health. So last week we talked about postpartum depression and postpartum blues, and what are the things that cause them to go into depression, and what are the things that cause them to go into blues, and what are the things we could do to prevent the depression from coming, and why it's important to prevent the depression from coming rather than wait until the depression comes, then only we do something about it. So we should always aim towards preventing the depression from coming rather than waiting for the depression to come, because a lot of times there's nothing, a lot of women, once they have depression, the depression can go on forever. So about 50 to 60% of mothers who develop postpartum or postnatal depression will actually continue to have depression for the rest of their life. And this is something nobody wants, because it will affect everyone around her. Okay, for her, she will be on medication, her life cannot be back to normal anymore. But not only that, to her husband, he actually sort of lost a wife, because the wife is no longer mentally stable, and the children also in a way lost the parent, lost the mother, because the mother with depression usually will not be able to give full attention to the children and do what most mothers can do for their children. So that is why we must always aim in preventing postnatal depression. So in order to prevent postnatal depression, seeing psychologists or getting a counselor or therapist before giving birth is very important. Don't wait until after giving birth. Don't wait until the depression already set in. It will just come in so sudden, and then it is a bit too late. Today I want to share one story. This particular lady, actually I know her for a long time already, because we used to work in the same hospital for a long time, and then after that she started being my patient from the first pregnancy, and now it's the second pregnancy. As I mentioned last week also, I actually see a lot of mothers from before the first pregnancy, from the first pregnancy, second pregnancy, third pregnancy, and subsequently after that as well over the years. So because my clinic already probably almost 20 years by now, and that is why we have actually quite a lot of mothers who have seen me before they were pregnant, and now they have already completed their children. Okay, those days they may be in her 20s, now she's like in the late 30s or 40s. And I see women change. Women change from a cheerful, happy, positive to somewhat a very negative, depressed, and you can see them aging very fast. A lot of all these things you see, and then when you talk to them and actually get the true story, you will actually see that something happened, and very often is postnatal. So this lady I want to share with you is, I know her for a long time because she used to work in the same hospital as me. And that time I find that she's a very nice girl, very cheerful, you know, every day we hee ha ha together in hospital. Very nice girl. And when she was pregnant with her first pregnancy, everything was still very okay. She's very positive, she's very cheerful. But somehow this time in her second pregnancy, I could sense something wasn't right. I could sense something wasn't right, because I could sense that she's not as happy as before, and could sense when she and her husband is in my room, the way they communicated among each other, no longer the same as the way they used to communicate in the first pregnancy. So I already deep in my heart, I felt something was not right. But I didn't say anything until today. She came into my room and she was all in tears. And then she did mention a bit of her problems, but she didn't say everything. But it did, in a way, probably compounded by things that happened in MCO because the husband lost his job. So she just mentioned husband lost job and my son is always want me to take care, the elder son. So then she was crying and crying, and then said, sorry, doctor, and then she tried to stop herself from crying. And she never actually expressed fully, but I did tell her to see my therapist. Why? Why I asked her to see my therapist? One is based on the last video that I told you. When you see mothers who are very emotional, always crying, always in tears, when they are not even during pregnancy, it is very, very a sign that we must do something. Because if we don't do something, any little thing that's going to happen to her during childbirth or after she gave birth is just going to tip her off to postnatal depression. So I'm actually very worried for her because I know her for so long already. So I'm actually worried from her, from a working colleague, friend to now being my patient. I'm actually very worried for her. But that's not the only thing. The next thing we want to talk about is what I'm going to talk today is fetal programming. This fetal programming, what is fetal programming? In the past, we always think that a lot of things are genetic. But now, over the last 5 to 10 years, we start to realize that not everything is genetic. Not everything is genetic. A lot of things, you must understand that each one of us has millions and billions of genes. There's so many genes, so many DNAs in our body. And that is why sometimes you will realize that certain things are skip generation one. Like for example, maybe let's say some features like your son is born with, let's say, blue eyes. Okay, I know Malaysian hardly got blue eyes. But your son is born with, let's say, features either blue eyes or maybe what do you call that? Something abnormal, not say abnormal, different. And then you look at his blue eyes, and then you see, hey, I don't have blue eye, my husband also don't have blue eye. Why my son blue eye? And then maybe you look up grandfather, hey, great-grandfather is blue eye. Oh. Then why great-grandfather blue eye? Now my son only blue eye. Why my father not blue eye? I not blue eye, but my son blue eye. So now what we know is that sometimes the DNA structures are all there, but it's how we activate which gene in our body. So you have so much DNA. You don't have to activate everything. In fact, you don't activate everything. You activate certain things, you don't activate certain things. So that is why sometimes you see certain things tend to skip. So this is one of the things that can happen with fetal programming. Another thing we know is, so this thing about DNA, what does it mean in our day-to-day? Then sometimes you will see that something so-called hereditary, but it seems to skip certain generations. So we know that the mother during the pregnancy has a very big role in programming what comes out of the baby. So that's why there is this concept nowadays for some people who take egg donor. A lot of women, when you ask them to take egg donor because they cannot get pregnant or they don't have good eggs, we say, hey, take egg donor lah. And they say, no lah, that's not my gene. Actually, she's not actually right because there may be a lot of overlap of gene between the donor and her, but ultimately is what gene she activates. So that is why a lot of times when you look at people who take egg donor, very often you can't really tell that that's not her baby. So you can see that, hey, that's her baby because it's how she activates whatever gene she wants to activate. Then what has it got to do with maternal emotional health? Yes, it also have got to do with that because we know that mother's emotions during pregnancy actually releases a lot of different hormones during pregnancy. When you are happy, you have a lot of happy hormone. When you're sad, you have sad hormone. When you're stressed, you have stress hormone. When you're guilty, you have guilty hormone. Our body produces different hormones for different types of emotions in our body. And these hormones that are released programs the baby. That's why these last 5 to 10 years, there are actually many research out there that has been done to actually look at this fetal programming. So we know that the same genetic structure, let's say if you have the same gene but you give birth in Africa, very poor, or the same gene, now you migrate to US in a different environment and not so poor, the same gene does not produce the same outcome. So mother's emotion actually can affect the baby's outcome. And we have even done researches where we actually scan the baby's brain. That means the baby come out, we go and do MRI, go and look into details of what happened to the brain. A mother that is happy, a mother that is very stressed, look into the baby's brain. It's not the same. We are so surprised to find that certain parts of the brain did not form the way it's supposed to form. But this part of the brain may control different things. That's why it affects the baby. And what is two things actually has been proven in many researches that is caused by the mother's emotion. Number one is hyperactive babies, hyperactive children. We have this attention deficit hyperactive disorder. These children is like so difficult to control. You don't know what to do with them. And sometimes we always say that there are more and more these type of cases nowadays. Why is it there are more and more hyperactive children nowadays compared to previously? Some people say is those days if you have a very hyperactive child, the parents will just probably cane him or whip him until he become quiet. But maybe because parents today tend not to whip children or cane children, but it's also the stress that the mother go through. Because nowadays mothers are more stressed. Why mothers are more stressed? Because of the lifestyle we have today. We no longer have a simple life where money is not an issue, education is not an issue, everything is not an issue. Like if 50 years, 100 years ago, a lot of parents, if you think back into, you grow up in a village. If some of you really grew up in a village, you will know your parents are not really financially strained most of the time because they have chicken, they have duck, they have fish, they have vegetable, they can eat everything that is planted and rare within the house. So they are not always financially strained. And they are not really bothered about what happened to the children. You go out, you play. By the time, dinner time, you know how to come back enough. Whether you study, you don't study, exam do well, don't do well. Most of parents are not really very bothered about it. But nowadays, parents are different. Money is a problem, so job become a problem. Now with this pandemic, people lose job. That brings more stress to the family. And we also bother about achievements, our self-achievement, and also what the family can achieve, the children can achieve. A lot of stress in the family nowadays, and as a result, women in pregnancy are a lot more stressed than women in the past. So you also see a lot more hyperactive disorders, children with hyperactive disorders. Of course, there are more than one factor for attention deficit hyperactive disorders, but one that we know that is well established in research is from this fetal programming. We talk about fetal programming. Mother's emotion, mother's stress, mother's feelings during the entire pregnancy actually affects the outcome of the baby. And many of my patients have already told me that many of the mothers that I see already confirm that to me as well. Like for example, I have another close friend. He's a doctor, so he adopted 2 children. I like to talk about both his children. One has hyperactive disorder because he's an adopted child. Why adopted children may have a higher chances of hyperactive disorders? Because can you imagine what is the mother's emotion during the 9 months of pregnancy, knowing that she's going to give away her baby? I don't expect her to be happy. I am quite sure she went through a lot of ups and downs, because I'm sure initially when she's pregnant, she may find it something she cannot accept, or maybe when she informed her partner and the partner said he cannot accept the baby, and all her emotions, I'm pregnant, you cannot accept, you make me pregnant, and now you don't want my baby, what do you mean? So all these things, her her emotions that she have to go through, the thoughts that she's going to give away the baby that she's going to carry for 9 months. I tell you, the emotions she go through is not going to be simple. So this is one aspect. So that's why we tend to see these type of cases in hyperactive disorders. So even I have one mother, she's a second pregnancy. I told her, all your emotions is not good because emotions can affect the baby. Baby may become hyperactive. Then she said, yeah, my elder son is so difficult to control. Doctor also suspect he got hyperactive. And then what was your emotion? Yeah, my pregnancy was horrible. I was so emotional, always angry, always crying. You see, this is the emotions you have during your pregnancy. It resulted in the outcome of your baby. So, and when you get hyperactive babies, hyperactive children, it's not easy. And the stress goes on. Because when you have hyperactive children, it's so difficult to take care of them. And as a result, you become more stressed. As a result, you're more stressed taking care of your child. You also end up always losing your temper easily, scolding your child, screaming at your child, and this goes into a vicious cycle. Because we know children, the more we scold them, the more we are angry at them, the more we scream them, the more we punish them, only end up making it worse. That's why we know that we should nurture a child with love and patience, and not anger and punishment, which is not the right way. So end up, it goes into a vicious cycle, and that's why we see it will actually end up with more incidences of drug addiction, missing school, gangsterism. That's why this outcome, it will end up first hyperactive children, then after that they tend to be more disciplinary problem when they grow up. They tend to miss school, they tend to go into smoking, drug addiction, gangsterism, and all these other problems that come after that. So that's why it's very important. Mother's emotion is the very beginning. A pregnant mother is very important to have the pregnant mother to be always happy, we say, stress-free. The other aspect of fetal programming that has also been very well established is delayed speech. You see, child's behavior is controlled by a different part of the brain. Speech is controlled by a different part of the brain. So when you do scan on these babies that are born of mothers who are very emotional, we tend to see these changes in the parts that control either the behavior of the child or the speech. Sometimes we do see children, in fact many come and tell me, Doctor, I'm so worried about my child, she's already 5 years old, 4 years old and not just talk. Why? But you ask her, does she understand? Yes, she understands. Anything you tell her, she knows how to do. You ask her, go and pick the ball, she'll go and pick the ball. Which means hearing is not a problem. Then why is she not talking? Does she say simple words? Then normally they will say, yes, I do. They do. The child maybe say simple words like, can call mommy, can call daddy, but that's it. Finish. Or yes, no, maybe not even yes, no, just nod his head, turn his head. So he thought he has vocalized in the sense that he can say simple words, but he refused to talk properly. He refused to open his mouth and say full sentences. And parents are very stressed when they get children with delayed speech. They will go around going for speech therapy, psychology, psychiatrist, child, pediatrician, see a lot of doctor, look at ENT, do ear check. But actually nothing wrong with the baby, everything is normal. And the more you stress, again, the child will be more stressed. And this example, again, I like to quote my very best friend, not best friend, a close friend of mine, a doctor with 2 adopted child. One that has hyperactive, the other one, delayed speech. Because I'm quite close with this doctor, so every time I see him in her hospital, he'll try to tell me again, you know my son, like that. So he's also very stressed. Why his son got so much disciplinary problem? Why his son got delayed speech? Again, it is adopted. Both are adopted. So if you're adopted, if the parents are not happy during the pregnancy, these are some of the outcomes. And not only that, even my own staff, I got one staff also, the child's so big, still don't want to talk. And then I also know her story. Because when she got married, the father was totally against the marriage between she and her husband. She actually got married after pregnant. She pregnant first, then only she get married. So it's like, you have to get married already because you're pregnant, right? But it is a man that the father cannot accept this man. So can you imagine the things that she had to go through the entire pregnancy, facing her father, her mother, her wedding? So at the end, she gave birth to a son that has delayed speech. And that is very obvious again, it's due to her emotions during pregnancy. So that is why I'm saying that mother's emotion during pregnancy is very important in the way it programs the baby. But the problem is, we also face one thing. We see a lot of mothers. I see a lot of mothers, and then when I tell mothers, like this lady I'm telling you, her first pregnancy, she's so much happier. She's so much happy and cheerful. And I've known her for like almost 20 years. We work together, from a colleague to a friend to a patient of mine. So when I see her like that, I'm very sad. But when you ask her, please go and see my therapist, then she say, wait maybe, I don't know, maybe financially constrained because her husband lost a job. But sometimes, some of them, even without financial constraint, they always feel like, no lah, I'm okay lah, I will be alright one. Or sometimes some women will even go and turn around and tell the husband, you don't make me angry anymore lah. They want to make it like, you are the one who made me angry, you are the one who made me sad, you shouldn't make me angry, you shouldn't make me sad. It doesn't work, okay? It doesn't work. Sometimes you may think that the real problem is your husband or someone else, but actually the real truth is the problem is you. Because you cannot accept whatever your husband have done or whoever have done to you. And that is why you become very emotional. So the real problem is still yourself, and the right thing to do to help you to solve your problem, to make you happier in your pregnancy, is still to get professional help. And professional help has to come from professional help. It cannot be talk to my husband lah, or talk to my mother lah, or talk to my sister lah, or talk to my best friend lah. They are not professionals, yeah. Professional help can be, some people go to religious teachers. I think if your religious teachers can counsel you properly, that's fine. And in fact, many will, because some people are very much religious and they are more willing to accept a religious teacher talking to them. That's fine. Or you have to look for people who work with mental health, like psychologists, therapists, counselors. We are talking about people who talk. I normally don't ask you to see psychiatrists. A lot of people have a lot of misconception. They say, I don't want to see psychiatrists. I'm not asking you to see psychiatrists. I'm asking you to see psychologists or therapists or counselors, because these people talk to you. Psychiatrists usually don't have much time to talk to you. They listen to your problem a while, they'll say, come, I prescribe you medicine. We don't want that. We don't want that. We want someone who will be able to talk to you and solve your problem. So this type of people are usually counselors, therapists, psychologists. These are the people you should look for. Or religious teachers. Yes, look for these people. Professional help. Because only these people can solve your problem. Then you won't go around blaming your husband and everyone else. Because sometimes when an outsider look at it, they will find that whatever your husband did is actually a small thing, but you probably overreacted. The overreaction is all due to you being pregnant, your hormones, and the things that happen to you entire pregnancy. Women have a lot of insecurity during pregnancy. They have a lot of fear during pregnancy. They're undergoing a lot of changes in their body. A lot of things going to change, not just to their body, to their life. Having a baby, a lot of things happen. You know, at the end you have to give birth. There will be wound on your body. There will be changes in your body that you may not be able to accept. And after you give birth, your life after that, your job, your taking care of children, your sleep, a lot of things changed in the entire pregnancy as well. Childbirth. So women got a lot of uncertainties, and plus all the hormones haywire. So they're very emotional. So don't live with being emotional. Don't accept being emotional as normal, because we know now that it affects our baby. We know now that it affects our baby. So instead of after you get a hyperactive baby, or your baby cannot talk until so big, still not talking, and then you become stressed and you do this, do that, do that, do that, do that, I tell you, at the end, you spend even more. That's the problem. Parents are willing to spend whatever amount of money for their children, but they forgot to spend the most important money on themselves. This seeing a therapist, a counselor in your pregnancy is not going to cost you more than whatever you're going to see later for hyperactive and delayed speech. So don't say that. Because that's what I always say. I see the mother, I say, you go and see my therapist. They say, I'm okay, I can cope. So the key point is during pregnancy, women should, number one, should be stress-free. We don't care what kind of stress. Whether it's emotional stress, mental stress, work stress, financial stress, whatever stress. They should be stress-free. But the thing is, how do you know whether a woman is stressed or not stressed? Few key points. Look at yourself. Or look at whoever that you know that is pregnant around you. Look at your wife. That's why I always say this video you must share with your husbands, your brothers, your male colleagues. They need to know. Because only an outsider can see the changes. You yourself may not be able to see the changes so much. Number one, what are the signs? First, sleep. Whenever mothers tell me, Doctor, I'm not sleeping well recently, to me that's a red flag. I must find a way to make her sleep back. So I have to explore why she cannot sleep. Is it the bed? Is it the pillow? Is it the weather? Or what else? Or is it her stress? If it's her stress, she cannot sleep, then you know already she's stressed. You must go and see professional help. You need professional help. Or else, sometimes they will show you, they tend to cry more, they tend to be angry more, but all these things they don't help me. They don't kind of tell me, Doctor, I recently very emotional. Or Doctor, recently I always very angry. These are things they don't kind of tell doctor one. So the people around her will notice, what happened to my wife? Why now she a bit baby cry, a bit baby cry, a bit baby cry. What happened to my wife? Why a baby I get scolded? A bit baby she's screaming at me. A bit she's screaming at the eldest son. A bit she's screaming at the eldest daughter. Something is not right with her. So don't just accept it. Maybe one time she's angry, but the next time she's angry is 1 month later. Okay lah, that's quite normal lah. Angry once a month. But you look at her, today angry, tomorrow angry, next day angry, rest 2 days, angry again. Something is not right. A bit too frequent. So she's very stressed. Because people who are stressed, they tend to explode easily. People who are stressed, they tend to cry easily. They tend to break down easily. So if you see your wife or anyone around you who become very emotional easily, very important, let them watch this video. Let them know that it will affect their baby. It affects their baby when it comes to the 2 issues I mentioned earlier, that is hyperactive disorders as well as delayed speech. But not only that, what if she gets postnatal depression? And gone. The baby will not grow up with maternal love, maternal attention that the baby deserves. So that has also a very big impact on the baby as well. So you see, mother's health, mother's emotion, mother's stress, mother's maternal health, mental health, all can affect the baby. So we cannot just accept it as it's okay. Cannot just accept it as it's alright, I will be able to cope. We cannot just accept it as it's normal, pregnant women are emotional. That's not right. We should do something. And the right thing to do is seek professional help. See counselors, therapists, psychologists, religious teachers. See whoever that gives you the best comfort. And that's why, because I see all these things, as I'm sure most of you have been following my videos, you know I have a team of therapists in my clinic itself. So we deal with mainly gynae health, and these are one of the things we deal with. And not just that, mother's emotional health also can affect the birth outcome. Birth outcome, when it means to, what I mean is whether the baby's head will go down or will it be breech, whether you end up with Caesar or natural birth. These things also always tend to happen when mothers are not emotionally stable. Because we know we have seen a lot, as a doctor, I've seen a lot mothers who first pregnancy happy, head down, second pregnancy happy, head down, then third pregnancy you can see already she's not the same person. That's why I say, being a gynae, we see mothers one pregnancy after another pregnancy, you can tell it's a different person. First pregnancy she's like that, second pregnancy something is wrong with this pregnancy, she's a different person. And then at the end up breach. Luckily I know how to turn the baby lah, I turn for her. But what if I don't turn for her? What if I don't know how to turn? Because a lot of gynaes don't turn babies. End up seizure lor. So it's again mother's emotional health. And we also know mother's mental health can affect our cervix. If you have listened to my talk on VBACs, I always label this word stubborn cervix. Or if you have read my book, this word stubborn cervix is always something I mention. Stubborn cervix is very related to stress. That's why women who are stressed also more likely to end up with seizure than natural birth. So you see, mother's mental health, emotional health is very important. It's very, very important. So don't just brush it away, say I'm okay, it's okay. No, it's not okay. Because it affects the baby. Because it affects your birth. It affects your baby. When after baby is born, it affects your baby's future and your baby's adulthood as well. It's all start from what happens to you during pregnancy. So let's not ignore it anymore. Please share this video. Anytime you see any pregnant woman very emotional, please share this video to her and her husband. You have to give it to her and her husband. Because sometimes women, when they're pregnant, they're also very emotional. So sometimes they cannot accept. Why you think I'm crazy? Or they start saying husband's fault. You don't like to blame the husband. We always blame husband one. Poor husband. Okay? So let the husband see as well. So they understand the severity of the issue. So we should not ignore it. Okay? So that's all I'm going to say today on this topic. Actually, I've seen many examples. I want to share one more example also. This mother had a lot of fear during pregnancy. Really a lot of fear. Really a lot of fear. I don't blame her. She waited like almost 10 years before she conceived. And then the baby also through IVF. Then she has so much fear during pregnancy. She'll come up with so many questions to kind of ask me, Doctor, this thing will affect baby or not? Doctor, I eat this thing will affect baby or not? Doctor, I do this thing will affect baby or not? You know, her question is only, will it affect baby? So it's always, will it affect baby? Will it affect baby? Will it affect baby? I mean, I understand lah, because she's so difficult to get pregnant, so she's very anxious over what she's doing, scared it will affect baby. But ended up, okay lah, she gave birth. Birth had a bit of complication as well because it was a premature. Suddenly she just go into premature birth and then she gave birth. But okay lah, not too premature. Stay in the hospital a bit longer, in the incubator, out the incubator, and then okay, go home after about a week. Not too big a problem. Yes, but see, number one, stress itself can affect birth. So even prematurity is can be linked to stress during pregnancy as well. So what happens is, a few years has passed, and recently she came back to see me. She came back to see me just for a normal gynae check, you know, like you always see your gynae, right? Every year to do your pap smear and things like that. So she came back to see me, and then you know what she told me? Doctor, I can sense that she's like very stressed, you know. So I said, you look very stressed. What my baby lor, my baby got autism. I said, is it that your baby got autism? Why you say your baby got autism? He said, I also don't know lah. One doctor say autism, one doctor say not autism. I also don't know which one to believe. Then I asked a bit more about what the baby is like. So I also don't think it's autism lah. But she noticed one thing. Only one thing she noticed. The baby refused to mix with other children, number one, and also refused to play. Like you bring the baby to a playground, most babies will go on the slide, go on the seesaw, go on the swing. The baby just don't dare to do that. Not dare. Very scared, very scared, very scared. So she said, maybe this thing very scared. Okay lah, we bring the baby to learn, you know, some music play group, you know. There's so much of this music class, so-called music class, that teach babies how a bit of music, a bit of singing, rhythm, and things like that in a group. Baby very scared, not dare to even touch anything. So it doesn't look dangerous at all. Maybe the playground look dangerous. Now you just want her to hit the drum, you know, or ring the bell. But baby not there, very scared. So you know what I told her? I don't think your baby got autism. I think your baby is just like you. Because that's exactly what she was the entire 9 months. Always worried, will this affect baby? Will this affect baby? Programmed into the baby already. Now the baby, what they, everything also not there to do. Because when I asked further, it still go on, you know, it's not just pregnancy. Now after baby is born, everything also they're very cautious. Will this affect baby? Will that affect baby? They won't let the baby, even though grow up already, cannot cross the drain, cannot jump, cannot, no, they're still very protective over the baby, and as a result, the baby is still they become very scared. So I thought, it's not autism. The baby is so scared because you have been training the baby to scare even before the baby is born. Throughout 9 months, all she had was fear. And now, all the baby had is also fear. Fear, everything scared. So it's not really autism. So you see how mothers affect the babies. How the mother programmed the baby to become what the mother want to program the baby. Or whether consciously or not consciously. So that's why I always tell mothers, women who cannot get pregnant, when we talk about egg donor, they're like, egg donor, that's not my gene. Now, I always tell them this concept about fetal programming. Because your gene is not important at the end of the day. At the end of the day, is how you program your baby. So that is why getting somebody else's gene is no big deal. Alright, so yeah, so that's all for my talk to talk today. Any questions, please post it up in the comment section. Anything else you want me to talk about, any topics you want me to talk about, just put it in the comment section so that I can put it in my list of future topics. And also, if you have missed all my old videos or you want to know more about postnatal depression, go to the link that I have to my YouTube channel and look at all my other videos. Yeah, fetal programming is a talk that I occasionally give in those public forums as well. Sometimes some of the mothers will ask me, let's say I'm very emotional during my pregnancy, and then now my baby come out, got hyperactive, and I really do not know how to control my baby. Doctor, is there anything I can do next? So sometimes the only thing I always tell mothers, the child is like that because of whatever you did during pregnancy. Because when you're angry, the child always thinks you're angry with the child. The child in the tummy does not understand why you're angry. The child will always think that maybe you're angry with me, or maybe you're sad because of me. So children tendency is they always blame themselves. They see a mother and father quarrel, they also blame themselves, even though nothing to do with them. That is the mentality of children. So that is why one thing that seems to help, this is something I learned from my therapist, one thing that seems to help is to say sorry to your baby. Say sorry to your baby. So what happens is that we say the best time to say sorry to your baby is when your baby is about to sleep. Like when you're making your baby sleep, right? Just before your baby sleep, or your baby just only sleep, that means still light sleep, not deep sleep. That is the time you should tell baby, Mommy love you, forgive Mommy for everything, Mommy love you. So these are the words that you just need to tell baby every night before she sleeps, or when she's about to sleep. Mommy love you very much, please forgive Mommy for everything, and Mommy love you very much. So sometimes these are the things that we really do to reprogram the baby's brain. We already programmed the baby's brain to be a difficult child, or we program the baby's brain not to talk, to have delayed speech, refuse to talk. So now it's to reprogram back, always say sorry. Always say sorry to your baby. Because it is something that you have done to your baby. Okay, so yeah. Hi Huini. Hi Huini, good evening. Hi Irene Suryana. Let's see if there's any question as I browse through. Hi Dai. Yeah, you have a favorite parenting book. Yeah. Thank you for your recommendation. Hi Ellie. Thank you Isulo. Yes. Okay. Vivian asked, can I join yoga class that was meant for pregnant women to reduce stress? Yes, sure, definitely. Yoga class is already meant to be for pregnant women. You can go for pregnancy yoga. It's meant for pregnant women. Of course, it's safe. No harm. Go. And yoga is one of the ways to reduce stress as well. It works. Definitely work. to a certain extent for people who are not too extremely stressed. Is it safe to do massage during pregnancy? Carol asked. It's safe to do massage as long as you do not hurt the pregnancy lah. So it depends on who is doing the massage. If you're done by real professionals who know what to do to pregnant women, actually there's no problem doing massage one. In fact, our clinic also we do some massage as well to certain cases where the mothers have, hip pain, back pain. We also do massage for them. So, but it's done by physiotherapists, professional, medical professionals, so they know what are the things that you should avoid in pregnancy and things that you cannot do in pregnancy. But you ask me if in general, shoulder massage, back massage, leg massage, leg massage, that's fine. Just don't simply massage your tummy. You want to massage your tummy, it needs to be someone who knows how to massage your tummy, So don't just simply go and find someone and massage your tummy. Okay, so I guess that's all the questions you have today. I hope you can share, most importantly, share, okay? Because this concept, not many people know. And a lot of pregnant women, they're so emotional, they have so much problems, but they just keep to themselves and they just go on with it. That's why we have so many hyperactive babies today. We also have so many children with delayed speech, children with hyperactive disorders. So please share. Anytime you see any mother who's very emotional, very stressed, not sleeping well, any of your relative or friend having that, share this video with them. Whether with them, with their husband, both, them and their husband, so that they know the implication of these type of issues and know where to go to find help. So always remember to share. That's the only way we can help other people. Okay, so that's all for my video today. So if you want to watch the other videos, please go to my YouTube channel and you can browse through the rest of the video. And if you want to listen more to more future videos on maternal emotional health next week, same day, same time, Sunday 9 p.m. This is a whole series. I have another talk about that's very interesting next week as well. So see you then. Thank you. Bye bye.